This week's Ask Dr. Durie comes from a patient who is very concerned about the risks of infection. And so he asks, how can we guard against the risks of infection for myeloma patients? So clearly this is a very important question, and patients with myeloma are definitely at increased risk of infections, particularly upper respiratory or pneumonia type infections. Also, many of you will have heard of shingles, which is a particular problem for patients with myeloma. And so there's a definite increased risk of infection for patients with myeloma. And so how do we guard against problems? Well, the first thing is that when a new treatment is being started, so particularly at the time of first diagnosis, but also at the point of later relapse, it's important to think about using preventative antibiotics, which means that you would actually start antibiotics and take it through the first 1, 2, 3 months of a new treatment protocol. And there have been studies done. In fact, a new one was presented at the American Society of Hematology meeting, the ASH meeting in December of 2017, that showed that there was a definite benefit in reducing infections with this preventative antibiotic approach. The risk of infection is particularly increased in the situation where the white blood cell count, the neutrophil count, is reduced, which can happen when the disease is active. It can also happen when very aggressive treatment has been used. In this particular situation, it is very, very important that myeloma patients be alert and seek immediate medical care if a spike in the fever does occur. And so this is a very, very important situation for patients with myeloma. And so broadly, how should patients look to try to guard against infections? Well, they should certainly consider the use of preventative antibiotics. And these can be antiviral medicines, something like acyclovir, or broad-spectrum antibiotics. They should also think about other things that might help to prevent against developing shingles. There is a new shingles vaccine which has become available, and so this is something to think about. There is also the possibility of using intravenous gamma globulin, and this is a type of treatment that is reserved only for really serious and difficult infections that might occur. And finally, there is a very simple thing to consider, which is a personal air purifier, which is a very small battery-operated device which can be worn around the neck and can reduce the chance of infection when you're traveling or might be faced to be in a situation where there are crowds of people. And so the bottom line here is infection is really important. It's a really, really important aspect to discuss with your doctor and have plans in place to be thinking about, will we use antibiotics? What antibiotics will we use? And I would emphasize in particular what to do if you would spike a fever if the white blood cell count is low. And so there can be discussions about how you might work to reduce the chance of the white blood cell count dropping on low. And so these types of planning discussions are very, very important around the aspect of infection for all patients with myeloma.